Family drama. We all have it, but it's never quite as acute as it is in the hospital where people come on the worst days of their lives. Sometimes that drama, however, is impossible to rise above the mess because the drama involves decisions with very real and very permanent consequences. What would you do when faced with a seemingly impossible ethical dilemma? Stay tuned. We'll talk about it. First, for all my future nurses, hit subscribe at the bottom of the screen for more NCLEX study videos. Today, we've got a critical nursing ethics case study you're likely to encounter. Remember, ethical decision-making is about delivering compassionate, patient-centered care, not just passing an exam. Visualize the scenario as we go. Imagine you're taking care of Mr. Jones, a 78-year-old patient with end-stage heart failure. He's alert, oriented, and has clearly stated he does not want resuscitation if his heart stops. He has a valid "Do Not Resuscitate" or DNR order in his chart, signed by his general practitioner and himself. The admitting physician has documented that he spoke with Mr. Jones regarding the DNR order, found him of sound mind and understood the decision fully, and the doctor has put DNR in as the patient's code status. Close case, right? Well, not yet. Mr. Jones's family arrives insisting that you do everything possible to save him, even against his explicit wishes. You direct the family to speak with your patient, but they are insistent that you must resuscitate despite the DNR. If you don't, the family states they will wait until he falls out and is unconscious to reverse the DNR. This ethical hotshot scenario puts two core nursing principles head-to-head. Autonomy, Mr. Jones's absolute right to make his own healthcare decisions, versus beneficence, the instinct to do good, even when others push emotionally. Time for your NCLEX trap alert. It's tempting to appease the family's emotions because they're upset. And yes, a lot of healthcare is customer service. But remember, when a competent patient has a documented DNR, your first duty is clear. Advocate for your patient's autonomy and uphold their wishes. You must gently but firmly explain the DNR order to the family, affirming that honoring Mr. Jones's choices is both ethical and required, and direct the family to discuss the status with Mr. Jones. At this point, he is the sole decision-maker. They'll ask you to call the doctor, and you can, and the doctor might come to speak with them. But the doctor is unable to change Mr. Jones's decision either. The family must speak to your patient. Nobody has the right to supersede the autonomy of an alert and oriented patient. How do you feel about that? Is it a little uncomfortable? Let us know how it feels in the comments, and throw a like if you enjoy great nursing content. And remember, yes, you can master your nursing licensure exam.